Hello, it's Dr. Rhonda Johnson, and today is Tuesday, June 8th, 2021. And today I'm going to be talking about the race between the coronavirus variants and the vaccines. Well, you've already heard about the UK variant. It became the dominant coronavirus variant in the UK, Europe, and the United States in a matter of months. The UK variant is more transmissible than the 2020 original coronavirus. The Brazil variant overtook the Brazil and South American countries in terms of it being the most dominant coronavirus. The Brazil variant is especially dangerous to babies and pregnant women. The South African variant is raging across South Africa and in many countries in sub-Saharan Africa, and has forced lockdowns in Kenya and Uganda recently. Now we have the India variant. It is so contagious that over 400,000 people a day became infected in India. Now the India variant is in 50 countries around the world and here in the United States. Recently, you may have heard that Dr. Anthony Fauci warned that the Indian COVID-19 variant is dangerous and could become the dominant strain here in the U.S. And in fact, it is already 6% of all the recent COVID infections here in the United States. 6% already due to this India variant. Now, the World Health Organization renamed the classification of these variants of concern. These are the variants that, are worrisome to the health experts. Now they're named by the Greek alphabet. So the Indian variant is now called the Delta variant. Now, in Vietnam, a country that successfully contained the coronavirus last year, it is now battling a growing outbreak. And it's a variant that's a combined hybrid of the India variant and the UK variant. Why am I saying all of this? Because these coronavirus variants keep mutating and changing, and the changes are not necessarily going to be in the human race's favor. These combinations are more contagious, more deadly, more transmissible, affects younger and younger people. So folks, we have to be concerned. Here in the United States, at least 63% of adults over the age of 18 in the United States have received at least one dose of the COVID-19 vaccine, according to the CDC. However, what I want you to remember, that COVID is a disease of person-to-person transmission, primarily via the airborne and the respiratory droplet route. And what matters is not the level of vaccination in the United States, but the level of vaccination of people around you in terms of your risk of getting infected. So what about the vaccines? I was asked by a person who follows my videos on Facebook to do a message about the vaccines and their effectiveness against all of these variants. So this video is really for you, and thank you for watching. So the experts, the public health experts, maintain that the vaccines are effective against all of the variants, including the Delta variant or the India variant. There was a recent study from Japan that provided supporting evidence, and there was a recent study which has not been published in peer-reviewed journals yet here in the United States, but it's from researchers from NYU that say the antibodies in fully vaccinated people are a little bit weaker against the Indian variant, but the vaccines still produce antibodies that work. So we're safe for now. But the bottom line is, folks, this virus keeps mutating. This coronavirus is not just going to sit around and peacefully be eradicated from the face of the globe without a fight. It's mutating, and the mutations are worrisome to the nation's top health experts. So therefore, we have to keep up the efforts to get folks vaccinated. Now, all of you who have been listening to me know that racial classifications are arbitrary. There's only one race of human beings, and that's the human race. However, here in the United States, we classify people by racial classifications. So if you are a white American, you can feel comfortable knowing that many of your fellow Americans are fully vaccinated. However, the CDC recently issued a report last week looking at the race and ethnicity of folks who are vaccinated here in the United States. So if you're African American, folks, we still have a lot of work to do. The recent report that I referenced from the CDC showed that the race ethnicity data was available for roughly 57% of people who have had at least one dose of COVID vaccine. And of these 97 million people who have had one dose of the COVID vaccine, only 15% of these persons were African American. So the African American community has to continue to step up efforts to get people vaccinated. We don't want to see what happened in India happen here, and it really can, because in many low-income communities across the United States, irrespective of race, there are a lot of people who live in multi-generational housing, who use public transportation, who work on the front line, and who aren't vaccinated. And folks, we still have to get our children vaccinated. We can have children as young as 12 get the Pfizer vaccine, and we still have to work on young adults to get them vaccinated. Folks, if you're going to be afraid of something, don't be afraid of the vaccine. Be afraid of this coronavirus and all of its rapidly worrisome variants of concern variants. This is Dr. Rhonda Johnson. My views are my own as always. My only goal is to help save lives. Stay blessed, take care, and have a good day.